Hello, wonderful people of Four Life family. So it's my absolute delight to welcome you all in today's session on oral hygiene. So today we have Dr. Shrutika Jayaswal with us, and Dr. Shrutika Jayaswal is a dentist by profession, and she has been practicing since 9 years now, and she has helped thousands of patients get wonderful smile and better oral hygiene. So welcome to the panel, Dr. Shrutika, and we are really happy and excited to have you.
Thank you so much, Shweta, for inviting me today.
So basically, as a practicing dentist, we would like to start by taking your observations on good oral hygiene today. So what type of toothbrush and toothpaste should you think that everyone should be using, and what are like the key pointers that one should remember while selecting a toothbrush and a toothpaste?
First thing I recommend everyone is soft bristles toothbrush, because soft bristles toothbrush are really important for cleaning your teeth because it does not harm your enamel. Even though if you try to brush harder, the bristles are soft enough to take care of it. Second thing I always recommend is rounded edges of the bristles. Why? Because it does not irritate your gum line, which leads to less bleeding if you have any infection. So rounded bristles always help, as well as soft bristles toothbrush is what I recommend for a better cleaning.
Okay, so the softer the better with rounded bristles.
Right.
So that's the right answer. Okay, and how about toothpaste?
So toothpaste usually I recommend is with less abrasives, because nowadays the commercials are too much on the market.
Yeah.
So always everyone are recommending the whiter toothpaste for a brighter smile, which I will never recommend, because at present or after using it you will definitely see a brighter smile, maybe for some days, but later on you will observe that the teeth are getting more yellow towards a darker shade, because the abrasives in the toothpaste are harmful.
Okay.
So with less abrasives, as well as sugar free.
Okay.
Nothing like that.
Superb. So one, it should be less on abrasives, and the second thing is it should be sugar free. So superb. That's an amazing tip for that. And what do you think about abrasive toothpaste that we get over the counter in the, like how can we compare them with our brand?
Definitely, I can show you with an experiment immediately now how you can differentiate between an abrasive toothpaste and a good toothpaste for your teeth, because toothpaste is something that we use every day, and as per our recommendation, we ask you to use it twice a day. So if you are using something so frequently, it shouldn't be more abrasive, right?
Okay.
It shouldn't harm your teeth. So
exactly.
I'll show you with an experiment
Let's
away.
Begin.
So let's start with the experiment. So here I'm using a commercial based toothpaste on a tin foil, and this is Shweta toothpaste on another tin foil. We are using a soft bristles toothbrush, the way we are supposed to use it on your teeth. Now I am using it with the Shweta toothpaste. Now we'll see the difference. So can you observe the difference? The tin foil has become more light
Yeah.
Okay, the coating has been removed because of the abrasive teeth or abrasive toothpaste. And when you see Shweta, it is same. Just the paste has been seen on the.
Okay. So this is the Shweta one, and it looks better than this one, definitely. So this has a lot of stains on it, I can see. And
It is the color change.
so this is the color change. Yeah.
If you try to wash it in the running water, you will see much better difference when
Okay.
you, because now I have just wiped with the tissue, but when you wash it with the running water, you will see the difference between the abrasive one and the natural one, much better for your teeth.
So this one is leaving a lot of stains, and this one looks much clearer.
Yes, and this
So-
is harming the upper layer.
Upper layer of the teeth, yeah. The
Because
enamel.
the tin foil, the upper layer is gone completely in this toothpaste, and here it has maintained the upper layer.
I think it's an amazing idea for a layman.
Yeah.
Yeah, to just make the difference. Like, what's the difference between harsh abrasives and what is something that we are having very softer for the teeth?
Yes, because see, anything good for short duration is not recommended, right?
Exactly.
You should always wait for the results after the usage of at least for 2 weeks. Then only you will see the results. And when you see or use any abrasive toothpaste for better smile, white teeth, you will see the difference within 2 or 3 days because they are really harsh and they are abrasives. So this is not recommended.
That is not a sustainable
Not
idea
at
to
all.
have a beautiful smile.
Not at all. Not for a long run.
For a long run, exactly. So if someone brushes their teeth regularly, is it then also necessary to floss your teeth?
Yes, flossing is equally important because brush will not reach in all the parts of your teeth.
Okay.
So especially in between your teeth. So when the food particle or whatever you are eating gets stuck in between your teeth, how much ever you try to brush, it is not going to come out. Floss plays the role in there.
Okay.
Okay, so it removes the bacteria or the deposits of your food particles from in between your teeth and makes it more healthy.
Okay, so it is very important to remove the plaque.
Yes,
Okay.
because the plaque deposits usually happens in between your teeth and on your teeth. So on your teeth you can definitely remove with the brushing, right? But what about in between your teeth?
Yeah, exactly.
So the floss helps to remove this thin layer of plaque that starts forming in between your teeth.
Okay.
So
and
that's
for
why.
cavities to form, the in between teeth is more responsible for that, right?
Yeah, because see, cavities usually start in between your teeth or it starts on your teeth.
Exactly.
So on your teeth you brush well and you can see
that,
But in between your teeth you will never see these cavities emerging.
Okay.
So for that, flossing is very important.
Okay.
It is equally important as you brush. So some people try to skip flossing, saying that हाँ हम तो 2 बार brush करते हैं, but it is not like that.
So daily you should be flossing.
Yes, at least once a day you should
Once a
try
day
and
you should.
manage to do the floss.
And how about tongue cleaner?
Very important, very very important, because tongue cleaning is something that people avoid. People
Yeah.
are not aware of. People say हमें आदत नहीं है, हमने कभी किया नहीं है, but 50-50 का रेशियो है. अगर आप ब्रशिंग करते हो तो आपने 50% आपका ओरल हाइजीन मेंटेन किया है.
Okay.
और जब आप टंग क्लीनिंग करते हो तब आपने 100% अपना दिया है.
You are ensuring it.
Yes, because the bacteria grow on your tongue equally.
Okay.
जितने आपके दांतों पे हो रहे हैं, equally they are growing on your
Tongue as well.
So tongue cleaning is important. What I recommend everyone, twice if you're brushing, twice you're supposed to do your tongue
cleaning as well.
Then only you can assure that your mouth is bacteria free and
Okay.
it's going to get maintained your oral hygiene well.
Okay. So tongue cleaning along with flossing, along with brushing 2 times a day is what Dr. Shrutika recommends, right?
Yes.
Okay. So what are the early signs of like dental troubles?
So you will observe bad breath, tooth decay. You will see more of gum diseases, bleeding gums. You know, the gums get swollen, they changes the color from light pink to dark pink or reddish, and it starts bleeding. So these are the early signs, as well as you will see mouth sores, you will see tooth pain, tooth sensitivity.
Yeah,
So-
tooth sensitivity
Yeah,
is very common.
Very common, very
In fact, even in kids also, we are seeing a lot of tooth sensitivity these days.
So these are the early signs. This says that you need to visit your dentist as soon as you can.
Possible. Okay, great. So Shrutika, what do you think? What causes bad breath, and like what are the treatments available for it?
Yeah. So the food particles, the breakdown of the food particles in and around your teeth, especially the deposits causes bad breath
Okay.
because it builds up infection. as the bacteria grow in your mouth, which leads to gum bleed and which causes plaque. So this causes bad breath. As well as food products, yeah, usually the Indians uses like the onions or the garlic. So raw usage of it, that causes a particular odor from particular person with that eating habits.
They have this very strong pungent
Very
smell.
strong. Yeah, they have this kind of smell which causes tobacco smoking. Even that gives bad breath. Poor dental hygiene. Medications, particular medications which causes bad breath. People on high antibiotics gives that kind of smell due to medications. As well as dry mouth, infection in your mouth because of the cavities, and other mouth, nose, ear infection also causes bad breath.
Okay.
In fact, stomach infection or bad stomach, that also gives bad breath.
Okay, so basically I think poor immunity, poor gut health, plus when you are on a lot of antibiotics, all these things will cause bad breath.
Dry mouth also causes due to less water intake.
Okay, so your hydration levels are also important.
Yeah, so it is very important.
Oh, okay. So for the overall health and for your oral health, so hydration levels are very, very important,
Of
right?
course, it is very important.
Okay, so what do you think are the treatments available for this?
You should maintain your oral hygiene well, like
Number
as
one,
I said,
Thumb
brushing, flossing, tongue cleaning. You should change your toothbrush every 3 months. This is very important because the bristles are not that strong enough to go for years. So you should keep changing so that the bristles are strong enough to brush your teeth well and remove the upper layer of your teeth. So this is very important, that if you change your toothbrush every 3 months, as well as avoid food, the onions and garlic eating raw. If you're going out somewhere or something, you have anything planned, so avoid eating all these kind of products before your plan immediately. Visit your dentist regularly. That is the key point.
Yeah.
Get your cleaning done. The regular 6 monthly, the scaling and polishing, the technical term comes up with scaling and polishing. You should get it done with your dentist every 6 months to maintain your oral hygiene well.
So if you are having a healthy oral cavity, then also you should be regularly visiting your dentist like you visit your physician, right?
Yes, it is very important. I always say your mouth is the part of your entire body.
Yeah.
So that should be taken care of.
Yes.
People nowadays go and get their regular annual health check. But they are not concerned about their oral health.
Oral health, yeah.
Your immunity, your body immunity also depends on your oral health. If you have a healthy mouth, you eat healthy, you breathe healthy, so you stay healthy.
And also it also affects your entire personality, right? Yes. So the way your oral cavity, your skin looks like, all these things are very, very important.
It gives you a different confidence.
Yes, it of course gives you.
When you smile good, you say the best thing you wear is your smile.
Smile, exactly.
Right? If you smile good, if you smell good, it's very important.
Very important, exactly. So also, and like when you have like infections or a viral fever or something like that, then also I think it is recommended to change the toothbrush, right?
Yes. After any kind of medical health problem, either it is infection or a fever or any kind of even COVID. In case. So all these things you should always change your toothbrush, because when you are having any kind of viral infection, you brush your teeth and the viruses are on your teeth. On your teeth as well as your brush then. So when you are healthy, after all the infection is gone, you should always change your toothbrush.
Okay. And also some people have a very heavy hand when they are brushing, so the bristles look very frayed. Yeah, so change it.
The moment you see like this, you should change your brush.
So 3 things you should be remembering. The first thing is every 3 months change your toothbrush. The second thing is if you have been on any, like if you had any viral infection or something like that, change your toothbrush. And the third thing is if you have a very heavy hand and the bristles look frayed, it's time to change your toothbrush.
Because you're using a soft bristles toothbrush. So that tends to happen because you're using it very hard.
Okay, so these were some amazing points that we have captured now. Okay, तो श्रुतिका आपको क्या लगता है, जैसे काफी लोग कहते हैं कि मीठा खाने से या बहुत ज्यादा ठंडा या ऐसी बर्फ जैसी कोई चीज खाने से आपको दांतों में प्रॉब्लम होती है, so what's your take on that?
See, मैं तो सब खाती हूँ. ठीक है, और मैं किसी को मना भी नहीं करती कि आप ये मत खाओ या वो मत खाओ, बिकॉज खाना सबको पसंद है. सो खाने से मैं मना नहीं करती हूँ, बट हाँ, खाने के बाद आपको ध्यान जरूर रखना है कि अगर आप मीठा ज़्यादा खा रहे हो तो आप रिंस कर लो, ठीक है? तो जो भी चिपका हुआ रहेगा आपके दांतों पे, एनीथिंग दैट इज देयर ऑन योर टीथ विल गो, सो दैट यू रिंस वेल. पीपल हैव अ हैबिट कि वो मीठा खाते हैं रात में और फिर वैसे ही सो जाते हैं. ये दिस कॉजेस बैड breath or cavities in your mouth because these sticky products get stick on your teeth and वो cavities form करते हैं. So हमें क्या करना है, हमें खाना सब कुछ है बट हमें एक हैबिट रखनी है कि हम रिंस कर रहे हैं वो सब खाने के बाद. आप मीठा खाओ, आप स्टिकी कुछ खाओ, कुछ भी आप खाते हो तो आपको रिंस जरूर करना है. सो यू मेक अ हैबिट ऑफ रिंसिंग आफ्टर ईटिंग विल डेफिनेटली प्रिवेंट ऑल द कैविटीज इन योर माउथ एंड एनी काइंड ऑफ डेंटल प्रॉब्लम व्हिच इज कमिंग. सो दिस इज व्हाट आई रेकमेंड इन रिगार्ड्स विद ईटिंग हैबिट्स. रेस्ट अबाउट आइस ईटिंग. बहुत से पेशेंट्स हैं जिन्हें आइस खाना पसंद है. आई डोंट रेकमेंड दैट because ice causes sensitivity at a higher scale because it is very cold. Second thing, breaking ice. अगर हम ice चबाते हैं, high chances of breaking your teeth or fracturing your teeth, which is not good. So ice is what I do not recommend. But हाँ, खाने में आप sweet खाओ, आप कुछ भी खाते हो, that is what I will recommend. But ice which causes higher sensitivity and fracturing your teeth structure is what I will never recommend.
What about the बर्फ का गोला that we eat?
बर्फ का गोला चलता है क्योंकि वो तोड़ोगे नहीं आप ना, that is already
smashed.
crunched, yeah. So that is fine. That is still fine. But eating ice raw is not. I will not recommend.
Is not a good idea.
Not
so
good.
everything in moderation. Yes. And the second thing is, like gargling after eating
everything
any
in
sweet
limit
thing.
is good, obviously. Anything is limit because more of sweet or more of any packed products is not good for your overall health. So you should not eat or drink something like this. But in case if you are having something in a while, so just make a habit of rinsing well, so that will help.
So ice is, I think, not a good idea for
Not
kids and for adults because it is going to fracture your teeth. So better avoid it.
Avoid it. Yeah.
Okay, so what do you think, how is immunity and oral hygiene related?
So mouth plays a big role when it comes to immunity because things, whatever goes inside your body will obviously go through your mouth.
Mouth only.
Right? So if your mouth is healthy, everything goes inside is healthy. Right? So even air, when you're yawning particularly, so even air goes through your mouth. So that is the reason your mouth should be healthy for a better immunity and a stronger immunity in your body. So if your mouth is healthy, your body will definitely be healthy.
Okay, so it is like the first line of defense. It is getting all the microorganisms inside from the mouth only.
Yes.
So at the first line of defense, if we are protecting our health with ingredients which balance your immunity, which are really good for the immunity, then it would be a good idea, right?
It is a very good idea.
Superb. So Shrutika, many people they want to whiten their teeth, and especially in the age of social media, everybody is very much conscious about how they look, and like the close-up shots and everything. Everybody wants to have whiter teeth. So is it recommended, and is it really good, and what's your take on that?
Whiter teeth, definitely I'll recommend.
Okay.
But I will ask everyone to avoid any kind of whitening toothpaste. As I've always said that they are temporary and they are harming your outer layer of your teeth, which is not good. So avoid the toothpaste for short duration of your whitening. But yeah, definitely you can get your teeth 2 shades, 3 shades brighter from the current color in the dental office. With respect with your dentist, you can go definitely visit and you can get your whitening treatment done, which is not harmful. Okay, that will give you 2 or 3 shades brighter teeth, which is good for your smile as well as your social media if you're part of concern. So you can definitely get a brighter teeth, but in dental office, not with any kind of home remedies or any kind of toothpaste.
Okay, so it is better to have if you really want a visible difference in the shade, so it is better to go for professional treatments.
Yes, professionally you can get it done. They last long and they will not harm your teeth, as well as they will not make it brittle, or the enamel layer is not damaged with that.
Okay, superb. So what do you think about the sugar-free toothpaste?
I highly recommend it. For everyone, but especially for diabetic patients, it is very helpful because it is sugar free, as well as people who are having inflamed gums or who have problem with bleeding gums, so sugar-free toothpaste will always help with faster healing process.
Okay.
For their inflamed gums or say bleeding. So sugar free is what I really recommend. It is good for diabetes as well as for everyone in their day-to-day life.
So for everybody, sugar free toothpaste is ideal, and especially for people who have these inflamed oral cavities and bleeding gums, etc. Sugar is something which, like interferes with the healing process, so it's a good idea to have a sugar free formula.
Yes.
Perfect. And the best part is our Shweta toothpaste is also a sugar-free formula.
Yes.
So it has less abrasives, it is a sugar-free formula, it is really good for your immunity because it has transfer factors in it, which are these immunity building molecules which have this capacity to transfer immunity information from a donor to a recipient. So we have these molecules which are known as transfer factors, and these are proteins and peptides which are going to give your oral health amazing immunity benefits. And it has clove in it, it has vitamin E, it has mint as well as menthol in it. So it's a perfect formula for your oral hygiene.
It's a perfect package.
Yeah, exactly.
Yeah, of course, vitamin E acts as an antioxidant. Clove oil is antibacterial, anti-inflammatory, which will prevent any kind of cavities in your mouth, which is a great thing.
Yeah,
okay,
exactly.
It's natural, it is great. It has menthol in it, which gives freshness. So your morning will start with a good fresh smile, nothing like it. And definitely all the ingredients in it are going to help you for a better breathe. Okay, a better antibacterial, antifungal thing, and it will keep your mouth healthy, and the immunity will definitely improve if your mouth is healthy.
Exactly.
Right?
So the tagline itself says, smile your way to good health. So this is something we are giving a full package for good health, for your immunity, for your oral health. So that's Shweta toothpaste. So thank you very much, Dr. Shrutika. It was amazing to have you again on the panel, and we are really happy.
Thank you so much for having me here. It was a great experience, as well as I have used Shweta toothpaste. So my experience was very nice. I loved the product.
Okay.
Yeah. And thank you so much for inviting me today.